The United States pays more for health care than any nation on earth. More as a total, more as a percentage of GDP, more as a more per capita. Yet when you look at infant mortality, life expectancy, and death due to preventable disease, we rank either at or near the bottom. If you lose your job, you're going to have trouble getting new health insurance if you have a pre-existing condition. In Virginia, premiums can vary based on demographic factors, so some pay a lot more than others. And if you have the pre-existing condition, you may not be able to get any insurance at all. The number of Virginians who have health insurance provided by their employer fell from 68% to 62% just from 2000 to 2007. Small businesses are not covering their employees like they used to. In 1993, 61% of small businesses covered their employees. Now it's down to 38%. 14,000 Americans lose their health insurance every day. 46 million today have no insurance. When people without insurance go to the hospital and don't pay, those that do pay have to pay more. The average family policy is about over $1,000 a year, covering what's called uncompensated care. Premiums in the last 10 years have doubled, where the median income has gone up with inflation about 34%. That's expected to be to continue. And since 1987, 7% of the median income went to health care in 1987. Now it's 17%. Medicare and Medicaid today constitute about 3% or 4% of GDP. It will go up to close to 20 within the lifetime of some of the people in this room. All healthcare expenses are about 17% of GDP now. And if you project that out to the lifetime of some of the people in the room, you can see where it's going. Almost half the GDP will be healthcare. America's Affordable Healthcare Choices Act, HE3200, is a proposal in the House. It provides coverage, affordability, shared responsibility, controls costs, prevention of violence, and workforce investments. All businesses will provide health insurance, with some exceptions for small businesses. Private insurance companies will not be able to deny you coverage because you have a pre-existing condition. And all individuals will, with some exceptions, get health insurance, some with affordability credits. If you like your insurance, if it's a good insurance policy, you can keep it. The Health Insurance Exchange is a menu of options. All of the companies that want to sell insurance will participate in the exchange. It is modeled after what federal employees, including members of Congress, get on the first day of work. You get a package that tells you all of your health options, and you pick which one you want. Some are better than others, some are more appropriate to you, but you get to pick what you want. Where in many states there are in fact no options. In most states, all of the blue, most states, one company has a market share in excess of 50%. In the dark blue states, of the 9 states, one insurer has a market share of 70%. The benefit packages, the insurance policies have to cover the basic medical care, inpatient physician services. Also, of note, preventive and wellness services have to be covered without a copay. Prescriptive drugs will be covered. Well child checkups and whatnot will be covered, and mental health. If you want to pay more, you can get more with fewer copays and deductibles. You'd have to pay more for that. You can also have a premium plus plan, which could cover additional things like vision and dental and other things, even gym memberships if people are willing to pay. Public option shows, first of all, the Medicare and Medicaid would be the model. The Medicaid, Medicare Advantage, and Medicare, by polling, shows that they are more popular than private insurance. They're also much more efficiently run. Medicare administrative expense is 0.5% of what they pay out. Private insurance companies, it's between 7% and 26% or more. Employers, if you're in the exchange, your employer cannot mandate that you take a public or private option. You get the choice. And the public option will be financed totally by taxpayer, not by taxpayer dollars, but by premiums. It will not be subsidized. Those who are low income will get affordability credits to help them purchase the insurance. There will be caps on out-of-pockets. The co-pays and deductibles will be limited to $5,000 per individual, $10,000 per family. Medicaid will be extended to all individuals with family income under 133% of poverty. That's $29,000 for a family of 4. Competition in the exchange, we have a low-cost option that will keep the competition, will drive costs down. There will be investments in community health centers. There will be a prohibition against cost sharing for preventive services. If you're getting checkups and immunizations, there can be no co-pays, so you do not be discouraged from getting checkups. There will be community-based programs that help with prevention and wellness services. Investments in the workforce. There will be investments to increase the number of positions in the National Health Service Corps. There will be funding to focus many of those investments into primary care. And there will be expansion investments in education and retention programs for nurses. As people are aware, this doesn't come for free. But require large employers to be responsible for providing health care for their employees. They'll have to pay 72.5% for the insurance premium for individuals, 65% for a family. If they offer coverage, the employer can opt out. If they opt out, they have to pay an 8% surcharge. Small businesses with a payroll up to $250,000 will offer health insurance to their employees will get a 50% tax credit. Individuals with the help of affordability credits will be required to purchase health insurance. It will be deficit neutral and paid for. But the expectation now is it will be about a 10-year cost of $1 trillion. But whatever it is, we're going to raise the money for it. If it's $1 trillion, it will be paid for by cuts and subsidies to Medicare Advantage. Most of the money, $544 billion over 10 years, will be paid by a surcharge for that portion of your income over $350,000 for a family. Under $350,000, that portion of your income will not be taxed.